My name is Allison McMillan, and today I will be discussing proton pump inhibitors. Introduced in the late 1980s, they are now today one of the most widely prescribed classes of medications used. So today, my educational goals for my nursing students coming in from the GI clinic are that they will learn about proton pump inhibitors, also known as PPIs. So my learning objectives today for my nursing students are, at the conclusion, that you'll be able to name 2 PPIs. You'll be able to discuss some of the therapeutic uses of PPIs. You'll be able to explain the mode of action of PPIs. You will be able to recite drug interactions for short and long-term use of PPIs. And finally, you'll be able to discuss drug interactions and lab tests indicated for PPIs. So some common proton pump inhibitor medications are umbrezole, which is Prilosec, esomeprazole, which is Nexium, lansoprazole, which is Prevacid, pantoprazole, which is Protonix, and that comes in oral and IV solution. And then we also have the rabazole sodium and dexlansoprazole. So some therapeutic uses for PPIs. The most common therapeutic use is for gastroesophageal reflux disease, also known as GERD. There's also indications for use for laryngopharyngeal reflux, or LPR. Also gastric and duodenal ulcers. It's also a prophylaxis for stress ulcers. Also used for H. pylori infection. Gastric hypersecretion disorders like Zollinger-Ellison syndrome, and then also for the NSAID-induced gastropathy. So what's normal and what's abnormal? So up here, you'll see a normal stomach, the normal esophagus, and you'll see that the lower esophageal sphincter closes normally, which doesn't allow any of the acids from the stomach to pass into the esophagus. With GERD, you have an incomplete closing of that sphincter, which causes stomach acids to back up into the lining of the esophagus, causing lots of damage. So what do proton pump inhibitors do? So first of all, they are coated with an acid-resistant coating, so it cannot be easily destroyed by gastric acids. The proton pump inhibitor works by turning off the proton pump inhibitors located in the beginning of the stomach and in the esophagus, therefore reducing the amount of acid that's made and also causing a decrease in the amount of acid that travels back up into the esophagus. So some drug interactions you have to be aware of with the use of PPIs are those that take clopidogrel, which is a medication that inhibits platelet activation for acute MIs. They should be treated with a PPI other than Prilosec or Nexium because of the drug interaction. These medications should only be taken once daily and must be taken 30 to 60 minutes prior to mealtime. So what lab tests are indicated for these medications? For the 65 or older and females, you really need to get a DEXA bone mineral density scan because they're at high risk for fractures, especially hip fractures. And then also you want to check levels of calcium, magnesium, B12, and iron. So what are some of the adverse effects with short-term use? You have nausea and or vomiting. You have diarrhea, constipation, abdominal pain, flatulence, dizziness, and headaches. You also have an increased risk for traveler's diarrhea. You have an increased risk for community-acquired pneumonia, and again, those 65 or older are at increased risk for this. And then there is a rare incidence of allergic reactions with the angioedema and anaphylaxis, but again, this is rare, but know that it could occur. Long-term use, adverse effects with PPI use. You have hypomagnesemia, decreased magnesium. You have B12 deficiency, iron deficiency. You have a risk of C. diff. You have a risk of dementia, ischemic heart disease, chronic kidney disease. Again, those 65 and older and females have an increased risk of fractures, especially into the hip area. You have an increased risk of pneumonia, and you have an increased risk of gastric polyps and carcinomas in the gastric area. So what have y'all learned today? So after this short discussion, I want you to be able to at least name off 2 proton pump inhibitor medications, explain the mode of action for proton pump inhibitors, name at least 2 therapeutic uses for proton pump inhibitors, name drug interactions and or lab tests recommended with the use of proton pump inhibitors, and finally be able to discuss the short-term and long-term adverse effects for patients taking these proton pump inhibitors. Here is my reference page. I hope that you guys had a fun time listening to my discussion and learned a little bit about proton pump inhibitors. Thank you and see you next time.